add myself in. Hey, Roxanne. Hey, John. If you guys don't know me, I am Nurse Tanya from Awakened Wellness. I am by licensure an RN. I consider myself divorced from the sick care system. I want to see over here on YouTube, Facebook, if I can share my screen there so they can see the Quest scan. I think that I can do that. I had not known before if that was going to work, but I think I can make it work. Let's see. I got to minimize. Oh, and I am going to go ahead and click run test and see if that works. There we go. It is working. All right. So let me get you guys over here so you can see what's going on my screen. Hold on, hold on. I always forget where I go to find that. Dual camera. Here we go. Right. And then let me... There. All right. So you can see what I've got up. So a few of you are probably new here. What I am doing is called a bioenergetic scan. If you are not new here, this is what I have. Well, I skipped a couple of weeks because I didn't want people to get bored with it. But this is kind of what I do when I see clients. Oh, and I forgot, November's winner was Ariana Moore. So I sent her a message too. I will need her address. You can always register for a scan. So this is a client of mine who I work with distant. She is in one of my one-to-one packages, and this is deep, nice. Wow, I am impressed. So her body is ready to talk serious talk. When we do a scan, this amplification level goes from 1 to 15, 15 being the deepest, 1 being shallow. She is, about 4 months in or so to care. So that's pretty good. I love that her body is ready to go deep. This is just a comprehensive scan. So looking at basic body systems, we will, it's really important to say that only for education purposes, I absolutely, in my practice, never, ever, ever diagnose or treat specific diseases or conditions. We only look at the body. We want to support the body. We want to remove what is not supposed to be there, and we want to supplement or support what is missing. We always try to use food as medicine first, wherever we can, and sometimes we need more than that. Sometimes we need physical support in the form of a supplement. And no matter what, we always need energetic support. So this scan here is all about energy. It's about quantum energy, about your innate intelligence and your body's specific ability to heal. Right. I'm going to stop talking for just a second. Does anybody here have any questions? All right. Her adrenal glands are not happy. Energetic. This is just energetic. Red means over energized or in a state of inflammation or aggravation. Yellow means not enough, like energy or mitochondrial energy to function correctly, to get the job done. So adrenal glands, and then pre-test is just what things are like before we started. Post-test is if they will energetically balance. We energetically balance them with a imprint, with we believe water holds frequency. So I imprint specifically, I'll imprint these directions into this tincture, and mail them to my client, and it will energetically balance her. And the software will tell us how long it will take. Okay, so adrenals, they're not wanting to balance. We have to go back there and check that out. Arteries and veins not wanting to balance. Frontal sinuses, let's click on the pictures. They're kind of cool. So arteries and veins not wanting to balance. Frontal sinuses, low energy, but they do balance. So that's good. Joints, over energized, but they balance. Muscles, really low energy, but they balance. Pituitary, very low, but balances. And skin, a little bit aggravated, but will come into balance. So in her report, she's going to get a lot of information. Like it'll give you a little bit about the adrenal glands. It'll say symptoms you might be experiencing, the emotional aspect of the adrenals. We really always, this energy work, I love it because it really helps fill in the gaps for my clients because I'm not a therapist. The emotional aspect, I always do an emotion scan. We'll get to that. We'll share that as well. But that emotion scan you can use as a journaling tool. But when we energetically balance that if there's a need, we can refer out for counseling, for therapy. But a lot of times, just this emotion response, the body lets go. We know that the body holds emotions and traumas inside itself, in the organs. So then we go to the filters, and I need to do a little bit of work over here to find balance for, do you remember what it was? It was for the arteries and the adrenals. So just got to get to category here. There we go. So I go under info, go click the adrenals, click the arteries. I'm going to do it one by one and click scan. I've been in a training Friday mornings for this system. It's been awesome. And the presenter, they're in a different country, in England or somewhere. And so they don't say check, they say tick the boxes. You tick the boxes. It's so fun listening to them. All right, so then in this background is going to be kind of where some of our root causes sit. They are kind of from the of order importance, from the top to the bottom. And then I always look for things that are in the V and the X, the V's, the X's, if they're numbers like 1 through 34, that might be something we want to physically look at supplementing. Otherwise, we're just going to take note. But you'll see vaccination signatures. So the vaccinations that she's had in the past are part of the problem, part of the imbalance in the body. Then it's going to tell us a lot about filters. There is some opportunistic or bad bacteria that could be dealt with. And keep in mind, these are just energetic. So we are not diagnosing anything. And I don't see, at this point, I don't see a whole lot of parasite stuff showing up. So interesting. But look at that mast cell. So that's interesting. Mast cell activation, people who have got a lot of allergy issues. So that's pretty loud. That's a V. So that's something I'm going to be coming back to when I'm not here on live. I'm going to want to investigate that a little bit deeper. All right. I am looking at comments right now. If anybody has any comments, you are welcome to make them. At least give me a wave. Let me know who's really here. Lots of likes. I appreciate that. All the likes, all the shares. Thank you so much, Jen. You're really just tapping the screen. That is so beneficial. So if you don't follow me already, follow me. I posted a video the other day taking a poll. I need to take a poll on when my audience is available. I probably need to start doing this in the evening. It's not the most convenient for me, but I serve busy, open-minded professionals, and they are probably at work at this time of day and not able to get on TikTok Live. So this scan, we are just looking for potential products, like scanning through the products that I use here in my clinic to see if there's a good fit for her. Well, maybe that's not what I clicked on because these things are not making sense. What did I click on? Oh, yeah. So that's not what I want. And it is not, I'm not multitasking the best. So this isn't the scan I wanted, and it's not a big deal. I'm just out a little bit of time. I'm not out anything else. I'm just out a little bit of time. How is the scan done? Yeah, hey, Trixie. So this is the scanner. This is her saliva sample that she mailed me, and I put it on here, and this fancy piece of equipment reads her energetic impulses. And then I have to hook it up with this little thing, but that's just technical thing. So she's mailed me that, and then I just put it on there. And that scan is very similar to muscle testing. If you're familiar with muscle testing, and I will use some muscle testing as well as I am scanning through. I do all of this first, and then I go through and use quantum muscle testing to kind of test this test, and then kind of also marry in my own, what I know about her symptoms, what I know about her blood work, what I know about her functional tests, what I know about the assessment. So I mesh all of these parameters together to come up with a month by month, every 30 days, we change that protocol up. So yeah, I do so many different modalities to help my clients heal, to help my clients. I don't know about electrodermal screening, so you got me. I'm not sure. I'm not aware. I don't know anything too much about that, but it might be similar. I don't know. Yeah, so whoever is here, make sure that you register. You can rate, I give away a scan every month. So you can register every time you're on live, and I throw your name in the hat, and I give away one scan a month. And when you get the scan, you'll have to send me your DNA sample. If you want your imprints, you just will have to pay for the shipping. I'll cover everything else. Hey, Transcendence, how are you? And this client, we're waiting on some results. She did a saliva DNA test because I am pretty suspicious she's got some poor SNPs like the MTHFR. We did a stool test and a urine test. So I definitely like my functional tests. I don't use only this, and it all kind of depends on how complicated you are, how much testing we want to do. I do blood analysis too, so if somebody's got current labs, or I can get you a lab draw kit, we can go through and really look at your labs from a functional standpoint as well. So this is, we won't get too stuck on this list, but I'm going to recategorize them. This is just products, and just kind of for my information to see what might be helpful for her in this stage. And then, like I say, we will take all things into account, like her symptoms, her functional blood work, and where we're at in the detox process. So Eye Support is a supplement. Drainage Tone, that's energetics. I would imprint her energy into that. So CoQ10 is a need. Brain Support, that's going to be B vitamins, maybe some magnesium, like milk thistles there. Gymnema is a great herb for blood sugar balance. I use that. I make a few teas that I blend. One that I've got, we blend for blood sugar balance. It's got yerba mate and gymnema, rhodiola, and hibiscus for flavor, orange peel for flavor. So I do a lot of that in my practice as well. I will just blend my clients up a tea. All right. So next I want to go to it is called a information scan. So we're just going to run that. That really looks at chiropractic alignment on the meridians of the mouth. It looks at genetic SNPs as well as vitamin deficiencies. So we're just going to blow through that really quick here. How do you register? Trixie, if you go to my link in bio, there is a link there that will say free scan, I think. I don't remember how I have it titled, but that's how you can register for the free scan. If you would just like to purchase a scan and have one done, that is $250. I do a minimum of 4 scans, but I usually end up digging around for more information than that. For that fee, that includes a one-on-one consultation as well as 3 of the imprints, and that includes shipping, that includes all of that. And super easy to do. You can find that on, so link in bio, go to my website and then go over under shop, and in my Shopify there is a place that you can buy that scan. Once you buy it, I do have to mail you a little kit, and then you have to mail it back to me. So there's that little bit of time lag, but it works pretty slick. You can do it in the regular mail. You don't have to mail it any fancy way or anything like that. Again, there's some few new people on. So I did 2 giveaways just before I came online. Yesterday, I did an extra for Giving Tuesday, and Shannon Herod won that. So I'm going to be mailing her a kit. And then for the November giveaway, that winner was Ariane Moore. So I'm waiting for her to get her address, and I'll get both those little kits mailed out tomorrow. Hi, Cynthia. We're just working on a scan here. I'm not going to stay on too long today. I've got an online appointment at 1 that I need to get on and get prepared for. Anybody has any questions while we're scanning? Let's see. Transcendent says the post I did yesterday about a weird reading I got from somebody about radiation. I think it was radon. Yeah, Jen, if you've had recent labs, I can look at them. They really need to be in a PDF form. It doesn't work very well for me if people will screenshot me, and that's really hard. I kind of need them in a PDF. Blood labs, the more the better, and that is a $175 service. I plug them into my functional software, so then we look for function, how your body is functioning. We're not looking for diagnoses. We're not worried about your normals and abnormals, because a lot of people will go to the doctor because they feel crappy, and they run a little blood work, and then the doctor says you're fine, and they say, but I don't feel fine. So the functional perspective or outlook is perfect for that, because we want to know how you're functioning, and those normals, they're kind of worthless, really. Yeah, thanks, Jen. So, yes, so email them. My email, yes, is in my bio. Yep, yep, yep. So, transcendence, you were looking up the radiation or the radon gas. Is that what you're saying? Radiation, radon, yeah, they're kind of in the same family. Um, I haven't heard back. I've had a couple of people lately that radon has come up, and I usually tell them to get a little tester, test your basement, see what's going on, and the one gal had that, and she had a lot of mold, and she said she had a wet basement in this house that they lived. It had flooded a couple times, and like that was all over her scan. The mold and the radon was all over. Jen says, so emailing the lab results versus taking a test and starting fresh will be able to see the difference. If you're working with me, Jen, I would like to have both. I would like to see what that functional lab work looks like, and then I would like to see what you look like energetically. A lot of times they don't match at all. So we still use the energetic imprints for those subtle things to bring your body back in alignment. It's really almost like going to a chiropractor and a massage therapist. They both work differently, but they very much work together. So yeah, the functional the functional versus the energetic, they're super different, but very very complementary. And a lot of people don't work like I do. The way I work is very unique, and it gets results because I started working like this because I'm just one person. And in my little area, then I don't have to do so many referrals out. Like I'm solving more problems for my clients under one roof without them having to go so many different places to get all these other things done. Um, trying to look at your comments. Trixie, so you have to go to the website to register, right? Not necessarily the website. So just my link in bio takes you to a landing page. So to register for the giveaway, that's all the further you have to get. If you want to actually buy a test, yes, Trixie, then go to my website and go under shop, and then my shop there is categorized, and you'll find that bioenergetic test or the consult. All right, just trying to answer those questions. I think I got them. All right, so I want to get back to my scan here quick and just see in this information what we have going on. I won't look at it too deep here with you guys online. It's not very, this part of it is not very interesting, and it doesn't really make sense to the unskilled eye. This part of it I generally don't share with clients because it just doesn't make any sense. This cavitation on tooth number 29, we find a lot of people when they have stress in the teeth. The mouth is one of the hardest things to fix. But here, uh, I have a chart here in the office, but your tooth number 29 cavitation, and it's pretty loud. So that might be something that she knows about. It might be something worth investigating. Phosphorus, and that is a depleted mineral for her. And it looks like it's because of poor absorption. So, like gut health, like could we find some supplements with phosphorus? We could, but we really need to work on the gut health. And then she's got another tooth decay on number 17. So that, I don't, the dentist stuff is hard. We try to recommend biological dentists, and that is super difficult. I recommend that anybody gets their amalgam fillings out if they haven't done so already, but to make sure that you do it in a proper setting. Um, it's a big part of your health picture, and it's one of the hardest, most expensive things for people to fix. I myself had a root canal at one time. I had it taken out. I had like a cap over it, and now I just have a hole. Like I wear a mouth guard at night inconsistently. I don't want implants. My body doesn't like metal in it. It doesn't like foreign objects. So that sucks. But I went to a biological dentist and he did muscle testing. I only had one metal cavity, so that was good. I only had one filling, but when he muscle tested, I have thyroid problems, like pretty extreme Hashimoto's, and when he muscle tested, he said, "Yeah, this root canal is definitely affecting your thyroid." And the studies out there are, maybe they're not studies, maybe they're just all of us talking and sharing, but it's very connected that if a woman has had a root canal, that if she gets the breast CANCER, it's generally going to be on the same side of that root canal, because we are disrupting those meridians. Our body does not appreciate these disruptions. So you don't know what you don't know. But the root canal, they leave dead tissue in our body. I myself, I had a tubal and I had a hysterectomy, but I had my ovaries. But I wonder, are they dead? Do I have necrotic, rotting ovary tissue in my body? Because when we do those things, we disrupt the blood flow. We disrupt the life source. So I often wonder about that as well, but I'm not going to send a surgeon in looking for it. I'm just going to do the best I can with my health. Yep, I think your teeth and the sinuses, yeah, it's all connected. And like I remember, when I was pregnant, I didn't know anything. I didn't know about anything functional or holistic or anything. And I had went to the dentist. I thought I was going to have a tooth pulled or something. I was in so much misery, and it was a sinus infection. So like those nerves in our face are very hard for our body to distinguish where the problem is. So like our sinuses, all those nerves, your eustachian tubes, all of that is so connected, so connected. Jennifer, how do you know about the cavities? Do we also send the dentist information? Yeah, that is kind of up to the patient. I don't put a whole lot of weight in the system, like it numbers those teeth. And I don't know. A lot of times we will kind of table it until the next scan. And if it's the same tooth keeps coming up, or if there's pain or sensitivity, then for sure go get it checked out. Let's see. Looking at your comments, Jennifer. Hold on. I think I missed something. Cavities. You just went through the same thing, even had a CT scan, and it was a metal filling that was bad also. Had a root canal on the same side. Yeah, it's a big deal. It is a big deal. And everybody's got different philosophies, every dentist, everybody. So just trying to find someone that fits with your belief system is hard. And dentists around my area are few and far between. You just can't be that picky. Like, you just totally cannot be that picky. All right, still looking at comments here. Okay, guys, let me go back to, I got pretty sidetracked. I didn't get to the emotion part yet. Was just kind of, we got stuck on cavities, some amino acids, yeah, some things like that, some mineral signatures. And these I will imprint all of them. So we use a homeopathy type thinking with this system where like fixes like. So we will give the energetic frequencies of these things, which is like giving the body a blueprint and asking your body to fix it. I will do, this is one of my favorite emotional ones. It's called Never Well Since. So let's quick run that. It's Never Well Since. And then this client can use this as a journaling tool, or she can just chuck it to the side and never look at it again, but just use the imprint to help release these trapped emotions. So yeah, we just got to wait. It's going through remedies. It's going through like cell salts and homeopathy and all sorts of stuff. It's finding matches in the system. And I'm super excited. The class that I've been taking, teaching me how to program this software to use it exactly how I want. I can't wait. I have been working on that this week, and I can't say I'm really getting anywhere. I'm kind of stuck. So we have that class Friday morning. So I'm hoping that they can tell me more about it. So Never Well Since physical trauma, never well since the effects of injuries to the head or spine. So that is one. Never well since the effects of antibiotic use. Never well since the effects of over responsibility. And that's a big one. That's strong. That's an X. General emotion, never well since the effects of remorse. So carrying around, it could be guilt or remorse. Those emotions are very alike. Never well since the effects of a seashore. Interesting. So, all of our geography has got different energetic imprints. So something happened there. Emotions, never well, nope, nothing there. It's just a phobia. What's this one? Mental or emotional signature. So, and then like in the report, it will print these out, and she can use those as journaling cues. Like I said, or some people like to do the, rip, tear, burn things to release. Here's a general emotion that is loud. It's a V. Never well since the effects of rage, anger plus anxiety, wrath, or contradiction. So, and that usually is going to be liver, like liver congestion. Those kind of emotions really clog up the liver. Sexual pregnancy, never well since the effects of sexual abuse, sexual excitement, activity, postpartum depression, rape, childbirth, nursing, miscarriage, or puberty. That's pretty broad, right? That almost anything could fit into there. So surgery, never well since the effects of infection due to surgery. That's pretty specific. So sometimes when you get the scan done, you'll be like, that doesn't make any sense. I don't remember that. What I usually tell people is to get the list and then put on your voice recorder and hear your voice saying them. So record yourself saying them, then go for a walk and listen to your own voice saying them back to you, and just pause and reflect and journal. And then, especially for my female clients, if they're like, wow, that doesn't make sense. And so then the next thing, if it doesn't make sense, the next thing you say is this mine? Because we all know as females, we have like these invisible backpacks, and we, carry our own hurts and our own issues in the backpack, but we also go around picking up everybody else's junk and throwing it in the backpack and carrying it around too. So, And some of us are more that way than others, where we tend to take on other people's stuff. Other people, your personality traits are, you're good at shaking it off, but some people are not, especially if they are your child or your parents or your family. We tend to bear one another's burdens, which can be brilliant, but a lot of times we don't have enough sense to let them go. We don't know when to let them go. So if you get an emotional scan or a never well sense scan and you're like, nah, none of that makes sense, then really get deeper into thought and ask whose burden it is. Maybe it's not your burden, right? And how do you release it? All the same way. So in this scan, the tincture, the balancer, you would take 5 drops 3 times a day for 4 weeks to energetic release it. Or, if you just want to be done with it, go through the list and just prayerfully kick it out. Like, kick it out. You don't have to put up with any of this in your body. But when your innate intelligence is bringing it to the forefront, there's something there smarter than you, that deeper than your conscious, that wants to deal with these things. So it's a great tool. All right. Anybody, like a few people just popped in. If you have no idea what's going on, give a wave. If you want to know more of what happened here, you can go to YouTube. I am broadcasting live on YouTube and on Facebook, and those full-length videos will be there. So YouTube, Facebook, sorry, I'm just talking to my TikTok phone over here. I am multitasking. I do need to go. I only had a crunch amount of time, so I wanted to get everything done that we possibly could. I'm Nurse Tanya from Awaken Wellness. I consider myself divorced from the sick care system. So I work online and in person in my little hometown to help open-minded, ambitious, professional people embrace a new perspective, just like me, moving away from that medical model, taking control of your health using a more natural approach, taking responsibility for your health, improving your habits, and the way we eat, the way we live, the way we live. The body is created to heal. When you remove what is not supposed to be in there and replenish what is missing, the body will heal. Yes, we'll see you another time. Thanks so much, everybody. Please I have been doing my best to go take these lives and make those little clips and actually get videos going on TikTok. I am just I'm not a content creator. That takes so much time in the day to do all of this. It's just super time consuming. So I appreciate all your likes, all your follows, reposting videos. Every little bit helps. Some things that I want to make sure that you know about. Also, in my link in bio, I've got a little free program called Whole Me. So it is a 30-day program. We use the Whole30 food program. No sense to rewrite that. That's a great program. So that is a brilliant way to start the year. You can do it completely free, just with food, and then you're gonna save space for me. You're gonna save space for us to meet. You're gonna do some homework for that whole month. So you need to save 15 minutes to 30 minutes a day in order to do the work to really start your year off right. You can do it anytime, but it just happens that we do have the new year coming up. If you would like to add to that to really get your energy back, you can order the CellCore Jumpstart products. That'll open up your drainage, work on your mitochondria. You do that with that Whole30 food, some deep breathing and meditation, you're going to feel like 10 years younger after 30 days. So I have that you can take advantage of. And then I also have right now, if you are interested in working with me one-to-one in my virtual intensive coaching packages. I use Cellcore Biosciences, so we do a complete detox, and then we're going to rebuild your gut. When we rebuild your gut, we rebuild your health, and it does not happen fast. It is a lengthy process, especially if you have got diagnoses, if you're on medications, if you've got autoimmune disease, or if you have a history of cancer. It's going to take a while, right? I hold space for a limited amount of clients. And like everything, prices are going up. Prices will be going up in January. If you want to lock in December and in that price point and finish strong, you can do that. You can register, you can get onboarded in December. Then don't worry about it until January. Start fresh in January. If you're interested in that, you can go to my link in bio. Then go under information and under packages. There's everything that you need to know is right there. Register on that page. I'll send you an email that will give you a video of my package pitch. The prices, everything is all there. And then if you're serious, if you're ready, I'm weeding you out. I'm telling you what, I'm weeding you out. I'm done with discovery calls because that is a waste of time. Like, I am a college level type. When you work with me, it ain't kindergarten. You got to be able to tie your shoes, wipe your own ass, and show up for class. That is where I'm at. So if you want to work with me, you got to be at college level motivation. You got to be independent. I'll give you everything you know, but you're going to have to show up. You're going to have to do the homework. You're going to have to pass the test. That's all there is to it. You can make the dean's list, or you can flunk out. It's all about you. I can't do any of it for you. You're going to have to do the work. So if you're ready to invest, I'm weeding you out. I'm weeding you out with my emails. I'm weeding you out with my videos. When you're ready, you'll know you're ready, and I'll be here for you. But I'm not going to chase you down. I am not chasing you down. I'm not going to call you up and say, hey, I see you registered on my phone, on my website. Are you interested? No. You know how to get a hold of me. When you're ready, you're ready. And that is how I roll. Honestly, I don't chase, I attract. I'm not chasing you down. But if my tough love, no nonsense approach speaks to you, then I'm the coach for you. If you are annoyed by spelling and grammar mistakes, I'm not the coach for you, because I might have a 4-year degree, I might be an RN, but I am not a spelling or grammar major. You get on my website, I built it. Like, I am a solopreneur. I am my IT person. I'm my web designer. I try to do it all. So you will get the most humble and authentic me every time. I'm never gonna fake it for you. I'm just me. All right, y'all. You guys have a great week. I will. You know what? I don't think I'll see you next week, because maybe I will. I'm going to Florida for an amazing training, and I don't know if I'll be here Wednesday or not, but I will see you in the future. Thanks, everybody. All right, you guys got the short end of the deal over here, but I have to say it is for a reason, because my TikTok crowd is always more attentive. So they get all my attention. If you were watching that scan, that's awesome. If you would like to get a hold of me, I can't wait to talk to you.